Last night, President Trump hinted at a pharmaceutical tariff still yet to come.
He said 24 years of this, which I think is plenty given his lack of production. It's hard to think of the things that he's done good for Texas or for the country. I can certainly point to many things like his gun restrictions, his lack of wanting to fund a border wall and disagreeing with President Trump on that, and even opposing President Trump's election in 2016 and the most recent election.
All right, so what is Trump promising? Today, Scott Bessent said that some of those tariffs, including on the pharmaceutical industry, are still on the table. Joining us now is CNBC health and pharmaceutical reporter Angelica Peebles. All right, the U.S. imports over $200 billion worth of pharma products last year. What would putting these tariffs on products mean for Americans? Is my insurance company going to cover that gap, or am I going to be paying for it?
Well, we have to see what the details are. Of course, the president has talked about something like a 25% tariff, similar to what we've seen on cars. And the question then becomes, well, what happens to that price increase? Do companies just absorb it or do they pass it on? And so they're a little bit more limited in what they can do on the branded side. So those drugs that you know the name of, because they can only raise the price about the rate of inflation. And if they go higher than that, then they have to pay rebates to Medicare and Medicaid. So that limits them. But either way, the price of those drugs is so high that Brookings says that you will still feel the pinch of them. Now, what happens if the insurance company passes that on remains to be seen. But the other interesting part is on the generic side, because those companies just have less room to work with anyway. These are low margin products that make up the bulk, actually about 90% of the prescription drugs that are dispensed in this country. And those prices are so low that they don't really have a whole lot of room to raise those prices. So Brookings says that you might see things like discontinuations of drugs, but also drug shortages. So those are a few things to keep an eye on.
And I want to clarify for our audience, we accidentally rolled the wrong sound there. What the president, what Bessent said was, we're going to be announcing very shortly a major tariff on pharmaceuticals, quote, and when they hear that, they will leave China, they will leave other places because they have to sell. Most of their product is sold here, and they're going to be opening up their plants all over the place. How have the pharmaceutical companies themselves, what have you heard from the industry? How have they responded?
So, of course, the industry does not want to see tariffs. This is an industry that's basically been exempt for tariffs for about the last 30 years. So this would be quite a shock to them. And the industry is trying to tout the fact that about 2/3 worth of the prescription drugs used in the U.S. are actually made here. That number is skewed, though, of course, because the more expensive drugs are overrepresented and the cheap generic drugs are largely underrepresented. And like I said, the bulk of those are coming from overseas. And you have seen some companies move their manufacturing here. That's largely as a result of the 2017 tax cuts. So Eli Lilly has been one company that has been investing heavily in the U.S., but they also are trying to ramp up production of their GLP-1 drugs, of course. And so we've seen a few more manufacturing announcements, but they are going to have to make the decision here about what's more effective. Is the tax breaks overseas? Is that a better calculation? Or is it more advantageous to move their manufacturing? But these are long-term investments. It takes about 4 to 5 years to open a manufacturing plant. So one lawyer I talked to said that there's just so much uncertainty right now that why would any company make such a big long-term decision at this point?
That's what we keep talking about. The market abhors uncertainty. All right, CNBC's Angelica Peebles, thank you so much for breaking that down.